This is the second part of a two-part conversation with Dr. Brooke Jackson. In this edition, Dr. Jackson describes the differences in hair textures and styles that she encounters in her practice, as well as some of her recommendations for washing frequency and hair products. She also provides some practice pearls on performing a deeper workup and treating patients who present with scalp itching. Dr. Jackson concludes by highlighting some of the differences she's observed in her practice between female and male patients.
At the end of the day, there are many, many different hair textures. And so we have very, very straight hair that you may see in a Caucasian patient. We have wavy hair. There is curly hair, but then we have curly hair that has loose curls and curly hair that has tight curls. And sometimes people will refer to tightly curled hair as coily or kinky hair. And so on a spectrum, people who have more tightly coiled hair, that hair tends to be a little bit drier in texture versus wavy hair. And so the frequency of washing as the curl gets tighter, you should wash it a little less frequently. And generally, for people who've got very, very coily or tightly coiled, curled hair, about every 10 to 14 days. Now, can you see tightly coiled hair in someone who does not have skin of color? Anything is possible. I think if we did our 23andMe gene pool, we would likely see that we're all related some kind of way. And so I do think that it is the broader question is what truly is your ethnic background, just as we can have people who've got very, very dark skin with straight hair. And so I don't think you can necessarily look at the skin color and make a determination about what products should be used on hair. I think you really have to look at the tightness of the curl. And, thankfully, there are a lot of companies now that are making products for all hair types. And sometimes it is a trial and error piece of the patient has to experience different types of patients has to experience different types of products. Not everyone with curly hair is going to love a curly haired product. Some people find them a little too heavy or too greasy. I also always caution patients with very, very curly hair to avoid products that are heavy in alcohol because alcohol can be very drying. And so that can be a mousse, that can be a hairspray that, has heavy alcohol content that can be very, very drying. And for my colleagues, that is one of the considerations when you prescribe topical medications for patients. For example, with seborrheic dermatitis, we often prescribe topical steroids. With someone who has very, very curly hair, I would not necessarily recommend you prescribe an alcohol-based solution, like a topical steroid solution. You may want to prescribe a lotion or an ointment. For my patients who've got very, very fine, straight hair, the ointment texture is going to be too heavy for their hair, so they would likely prefer a product which is alcohol-based. In dealing with patients with hair concerns, even with seborrheic dermatitis, most patients will come in with itching. I think when a patient presents with an itchy scalp, you should ask a few more questions and ask if there's any associated hair loss. Because yes, seborrheic dermatitis, itching is a common complaint, and often we will provide medication just for that. But we also know that scarring alopecia presents with itchy scalps as well. And so I think that you do need to dig a little deeper with your seborrheic dermatitis patients, particularly if we can potentially make an earlier diagnosis for cicatricial scarring alopecia and an earlier intervention. Now, do we see these things primarily in female patients? I think for the most part, and I may be biased because probably about 80% of my patients are female, but I have seen male patients with scarring alopecias as well. Sometimes these are male patients who may have had a history of having had some sort of chemical treatment, whether that is a Jerry curl or some sort of straightening chemical. But my male patients in general tend to want to do fewer topical treatments. They actually prefer more action. So these are patients that, generally want to go straight to PRP or something that we are providing for them in the office rather than something that they are actually doing for themselves at home.
The discussion with Dr. Jackson concludes with an emphasis on the importance of giving each patient a proper and full consult and examination, giving time for both patient and physician to hash out any concerns.
Hair loss is a challenging topic, and I know some of my colleagues avoid those discussions because it can be very lengthy. But it is really a pervasive problem with our patients. And, we always try and juggle having time to address our patients' concerns with the pressure of getting backed up on our schedule. And so, one of the solutions that I found to be very helpful for my practice was really to segregate the hair loss patients to a separate day. And so that is one of the reasons that if anyone has a complaint of hair loss, especially a new patient or a new complaint of hair loss, I always schedule them into my hair loss clinic. And those appointments are 30 minutes long. And so that really does allow me the time to properly address all of their concerns rather than having to answer quickly at the end of a full skin exam or, having addressed 4 or 5 other issues and the patient brings up hair loss. And so I will gently say to that patient, I would love to talk to you about it. It is a very lengthy conversation. And in order to do it justice, I need to have you schedule into our hair loss clinic. And that has really been very, very, very beneficial. And I found that patients are fine with that, especially if they know that that is going to be the only concern that they can address at that time. And I am not rushed, and I can provide them a good amount of one-on-one time to address their concerns.
Thank you for listening to this edition of Practical Dermatology, the podcast. If you're interested in the topic of hair loss in patients with skin of color, visit this podcast parent publication, Practical Dermatology, at www.practicaldermatology.com or subscribe wherever you listen to podcasts.